We will start getting into our maternity action plan work session. As you heard, this meeting will be recorded. You are more than welcome to ask questions in the chat or raise your hand when participants will be when they're done presenting. So please feel free to add any questions you might have in the chat. If you don't have any questions or you're unable to stay the entire time, we will send this recording out to everyone afterwards with some reading materials as well, in addition to the map session. So you'll be really well informed afterwards. But yeah, with that being said, we can get right into it. Okay, so I just want to thank everyone again for being here today. This is a wonderful turnout. My name is Maxilia Desir. I'm a program officer here at the New Jersey Healthcare Quality Institute, and I'll be briefly walking us through the Maternity Action Plan, or MAP as we like to call it, and how this works. Essentially how this work connects to shifting power and centering community voices in maternal health reform. So at its core, this work is about moving from systems that speak about communities to systems that are shaped by them. So in partnership with many organizations, such as Robert Wood Johnson Foundation, Burke Foundation, some of the organizations you guys were a part of and have been a part of our original convenings, we wanted to highlight maternal health values, talking about breaking down systemic racism, centering lived experience of people, talking about improving how we collect and use data, reforming our payment systems, and building transparency into systems. So this is some of the feedback that we had collected from our MAP to action work sessions. And this is essentially what created the foundation for our maternal infant health values. Next slide, please. So some of you may be aware of this, but when we were first doing our MAP work session for this year, we sent out a survey to you all. In this survey, we asked essentially, what are some upcoming MAP events that you would like to see? Some previous ones included preeclampsia and things of that nature, where these results show a comprehensive overview of what many of you wanted to discuss. With our top 3 topics being maternal health workforce capacity, community-based care and social supports, health equity, anti-racism, and bias in maternal care and care coordination systems. And something else that was highlighted was innovative technology in maternal health care, and as well as data measurement and accountability. Next slide, please. So some additional topics that came out of the MAP survey, these weren't like super high up there, but these were some additional topics that were highlighted. Some were highlighting the New Jersey Menopause Coverage Act, and how we should discuss menopause symptom treatments, how that relates to overall women's health, dismantling systemic racism in maternal child health systems and workforce, maternal mental health care, the 4th trimester postpartum policies, and midwifery care was also very, very popular. So we just wanted to highlight that and give you some knowledge into what are some of the things that you guys were interested in. Next slide, please. So this is today's agenda for our MAP session. So you're currently reviewing our welcoming statements. We will then have Christine Ivery, who will go into the work that the Quality Institute has done with PCABs. We will then have this phenomenal presentation by Adelisa Perez and Christine Ivery again, who will walk us through reimagining partnerships through Prenatal Community Advisory Boards. What does it mean to work through PCABs, right? Then we will have a PCAB panel discussion with PCAB panelists, so people that actually work on the PCABs throughout the state. And then we will have wrap up and next steps. So you should honestly be out of here by 2:05 maybe 2:08 because we started 3 minutes late to settle everyone in. So hopefully that is fine with everyone. And we can get right into everything. So those were the priorities that lay the foundation for improving outcomes and advancing equity across the systems. Those values have included breaking down systemic racism, centering lived experiences, and creating accountability and building trust throughout systems. So, what this reinforces is that while progress has been made, there is still a clear need to strengthen how systems respond to community identified needs. So today's session builds directly on that feedback that you guys provided us. We'll begin with an overview of community partnerships and shifting power. So we'll hear from everyone, and I just wanted to give the floor to Christine Ivery, who is a leader at the New Jersey Healthcare Quality Institute. She has played a key role in advancing community-centered approaches to maternal and infant health across the state. She will be discussing prenatal community advisory boards and why this work is so pivotal to truly honoring community voices. She also walks us through what it looks like to move from, move with engagement to real partnership in practice. So Christine, I'll pass it over to you.
Wow, Max, thank you so much for a wonderful introduction to this program. I know myself, my colleague Adelisa, we have wonderful PCAB members that are here all to represent great work and what it's been leading up to. So I appreciate your welcome and appreciate everyone here for your time, your attention, and also want to hear from you all today, your feedback, your thoughts, as we are all working together, breaking silos and really advancing the work around health. And particularly, we'll be talking about maternal health today. So, as we go into conversations around what Max just gave us a really great runway to is community partnerships, how to really think about power shifting and having that power really be in the hands of community members that we work with, the residents, the patients that we serve, right? So, we know that communities are experts in their own information and the lived experiences that they pursue and that they do have. We know that we have to co-create solutions, and that's where our conversation comes in today with a more larger focus and a larger view as we think about perinatal community advisory boards and what this unique collaboration looks like. One thing that we really want to drive home today is decisions. That decisions should not be made on a siloed type of basis or in a closet type of basis, that there should be that transparency, right? That decisions could be made together. And that's what we'll be talking about more frequently with our discussion and course of conversation today. So I want to talk just for a few minutes about community power, shifting that type of responsibility into an equitable model of meeting people where they are, but then also how can we make it culturally responsive? How can we really eliminate all those isms that Max was just discussing? So three things that come to my mind around this conversation is one, shifting power, the focus of this conversation. And then two, shared decision making. And then three, in practice, what does this look like? So I'll start with shifting power. First, when we talk about shifting power, we are moving from doing for to how can we partner? How can we intentionally have community members, residents, our patients at the table? And not only have them at the table, but make sure that they are leading the conversations, that they are in the spear and the nucleus of our conversation, if you will. So that goes back to our components of equity, meeting people where they are, and really being intentional to have that aspect laid out. The second is shared decision making. So we are thinking about lived experiences. We are thinking about cultural practices. We are thinking about how to honor folks' lives and their walkthrough of what their life and what their experience is, and really honoring their perspectives. And we know that when we do that with that type of lived experience data, it's different from our numerical data, or it's different from our quantitative data. It gives us richness and this depth and this breadth that we normally can't grab on that data all alone by itself. So we're capturing not only those voices, but we're turning the voices the experiences, all the different perspectives into actionable changes and strategies. And we know that when those voices are included at the table and when those types of conversations are co-created, that it makes substantial change. And we see that can certainly, cause lots of dimensions of wonderful change throughout. The last is in practice. And that's what we're going to really transition into today. So with our PCAB members that will speak in a bit, with community members, any type of board, how can we make sure that our community members are looked at as leaders? They have this wonderful experience. They bring all this momentum to the table, but how can we really foster their leadership in these spaces in a respectful environment and in a safe environment where they feel valued and where they know that they are heard? So something that I always say, and something that I'm sure that a lot of you all on this call have heard, that there's nothing about us without us. That means that every voice, that means that folks with different languages, different identities, different types of backgrounds and walks of life, that means that everybody's at the table. So we'll be talking about that today. And with that, I'm going to transition right on into the PCAB model as me and Adelisa share a little bit more on some of the practical use of PCABs. Thank you all so much for your time. All right, I'm going to pull up our slides, and Adelisa, feel free to get us queued up. I'm looking forward to this conversation.
Great. Thank you, Christine, and good afternoon, everyone. I'm Adelisa Perez Hudgens. I serve as the Vice President of Quality at the Quality Institute. I'm a nurse by background, and just wanting to echo my colleagues and thanking you all for spending a portion of your afternoon with us. This session is really about creating change creating connections, and more importantly, creating change. So we'll share our PCAB model, what were our successes, our real outcomes, and more importantly, what are those lessons learned that we can really share with you all. For our PCABs, connection was really just a starting point, and that intentional connection grew into shared power, co-creation. You'll hear a lot about those meaningful systems change. So we're excited to share more with you today. Christine, if you wouldn't mind going to the next slide. Thank you so much. So kind of our objectives that we hope to go with you through by the end of today is really thinking about the structure and purpose of a PCAB, explore how shared power is operationalized, reflecting on what are those barriers to authentic partnership, and how do we identify actionable strategies to overcome them, recognizing that some strategies may allow for more immediate kind of change, and then others might be things that you really have to start thinking about and communicating and having some of those real conversations that may not result until change later on, and hopefully leaving with one concrete step to strengthen community connection in your own work. Next slide. In previous MAP sessions, and likely within all of your daily roles, we have all really seen and heard about those persistent inequities in maternal health that families continue to face, and how these inequities are rooted in historical and ongoing harms in perinatal care. We think of racism, bias, exclusion, other systemic barriers that continue to shape outcomes today. At the same time, one pattern that we consistently see is that traditional approaches to community engagement often stop at feedback. Community members may be asked to share their perspectives, but that real decision-making power often remains within the institutions to make that final decision. And when communities feel that their voices are heard but not truly acted upon, we see that trust erode. And that lack of trust between healthcare systems and the communities they serve will not automatically repair itself. It really has to be rebuilt intentionally, thinking about transparency, accountability, and shared decision-making. We saw a lot of this conversation really accelerate in 2019. With the launch of Nurture New Jersey, which many of you are familiar with, is the state's comprehensive multi-agency strategic plan to improve maternal health. We really developed the maternity action plan in response to that work, and focusing on different key areas that would help us really advance maternal health outcomes and experiences in our state. And as a part of that work, we interviewed and engaged hundreds of people, clinicians, community health workers, community leaders, advocates, birthing people, really anyone who wanted to share their perspective. And we saw a message that kept coming up again and again, and even through our other maternal health initiatives, is really birthing people and those who support them, whether it's doulas, community organizations, their family members and close relatives or friends, did not often feel heard. Their experiences, concerns, and ideas were often dismissed and left out of the decision-making process altogether. We also happen to be working with Robert Wood Johnson Foundation to implement recommendations from the National Partnership of Women and Families Raising the Bar for Maternal Health Equity and Excellence framework. And one of those recommendations was the creation of Perinatal Community Advisory Boards, or PCABs, as you hear us call them. connected directly to the hospitals. And so that work really led us to do research across the country, really seeing who out there are doing a similar model with PCABs, which are directly tied maybe to a hospital as opposed to a community or regional setting. And so we saw that there weren't similar models that already existed. That we did find that there were a lot of community advisory efforts. One state had a regional model. We know that there are a lot of organizations in New Jersey as well who lead maternal health conversations or have maternal health be a component of the conversations and convenings or work groups and committees that they host. But hospital-specific PCABs largely did not exist. And so when we're really stepping back and reflecting on everything we were hearing, we realized a few things. Is that the issue wasn't simply that community voices weren't being invited into the conversations, because in many cases they were being invited, and in other cases they weren't. And so the issue was really that we saw voices were often not included in the space where decisions were actually being made that impacted the hospitals or healthcare systems, ultimate decisions and actions. And that distinction really mattered, because engagement alone isn't enough. We really have to move toward shared power and shared decision making. And we needed maybe a different way of making decisions, which led us to explore a model that intentionally centers lived experience and creates a structured way for community members to partner with health systems. And that's where PCABs came in. And the interest and the need for them were very clear as we continue to have conversations around what a PCAB was. And Christine, I think there was an action there. If you want to click, I think a little bit will come up, and one more. Thank you. And you can actually go to the next slide. And so we want to pause. As you've heard a few of our colleagues mention, we are hoping today is a little bit interactive. You're asking us questions. We're asking you for your thoughts. And so we're asking everyone to join us in this Mentimeter activity. So if you wouldn't mind taking out your phones or scanning the QR code, I think we're also going to put it in the chat box. Thank you, Isa. She's way ahead of us. So it's also in the chat box if you don't have your phone handy. So we'll ask everyone to head over to the Menti. And what we're really asking is for you to think about what is one barrier to creating authentic community partnership. You can submit more than one, but at least one per submission. So something that you've experienced or that comes to mind when you're thinking about those barriers to creating authentic community partnership. So don't focus on the solutions, but really what are those barriers that prevent that from happening? And Christine's going to pull up the cloud as we start to see responses come in. And we'll give folks a minute or two here to get their responses in. We see time and trust, not listening. Try to capture these as it's moving around a little bit. Lack of transparency, stigma, lack of compensation. We'll talk a bit about that. Transparent communication, hierarchy. I see in the chat box, archaic regulations, time constraints, fear of doing it wrong. How powerful is that statement, right? Sometimes just the fear of wanting to do something and not doing it the right way can prevent us from actually taking action. Commitment, not listening. See some more bubbling up here as a lot of folks are putting in answers around time, hierarchy, trust, power imbalance. So really seeing those common barriers come up, right? Those time constraints, funding limitations for some of them, as we see maybe compensation or just the ability to host some of these convenings and conversations, burnout, inauthenticity, structural limitations, power imbalance. Great. All right, I see a majority of folks have responded, so feel free to keep putting in if you haven't yet. We'll definitely want to capture everyone's thoughts. And then we'll actually move to the second part of the survey here. So Christine, if you wouldn't mind. Yep. And so thinking about, someone in this room has already thought about this, is already maybe taking actions for some of these barriers that we saw. And so inviting all of you to share a strategy for successfully building trusted community partnerships. Maybe it's something that you are already doing or that you've heard about that has been successful somewhere else. But want to just hear what you guys are thinking. Great, see a lot of networking coming in, authentic relationships, building trust. Accountability. Networking is still pretty high up there. Authenticity. So there's a few folks who have navigated this or are actively working in some of this space. I'm definitely willing to open it up and share if anyone wants to, maybe a person or two. I'm happy to, just hear from you and share out on any of these approaches or strategies, what worked really well for you. Accountability, networking, respect. Does anybody want to share how they demonstrated or made some of these concepts actionable, either in the chat box or if someone wants to raise their hand? Thanks, Vanessa.
Hi, this is Sakura Ando from the New Jersey Family Planning League. I just wanted to share that something that I really noticed our communities being vocally appreciative of when we start community partnerships is when we acknowledge historical mistakes and really owning up to a lot of things that maybe we've been part of or noticed. And I think it's amazing because it's a step forward from the land acknowledgements that we hear a lot, because sometimes we hear it and then we go, okay, so what are we doing about it? And this kind of takes it to the next step. And I think it really shows a lot of not just the accountability, but then the humility that we can show. Thanks.
Thank you. Well said. Thank you for sharing that. And Eric, I saw you raise your hand, but then I saw you put it in the chat box. True engagement is a process and seeing their feedback in play. Yeah, and being open and to also hearing that feedback back, right? Especially if you are that institution, is being a little bit vulnerable and a little bit open-minded and willing to hear and be receptive to what anyone within the community or your colleagues may be sharing with you. So thank you everyone for sharing that. Christine's going to pull up the slides again. But in the following slides, we'll really share a little bit more about our PCAB model and how it's structured intentionally sent out to respond to some of these realities and these barriers that we heard from you all, and how it really did include a lot of the strategies and actionable ways that we can start to break down these barriers a little bit. So we'll start off with just what is a PCAB? At its core, a PCAB is a structured partnership between hospitals and the communities they serve, specifically focused on improving perinatal care. PCABs bring together birthing people, community leaders, social service providers, and health system representatives to collaborate on improving maternal and infant health. So what makes this model important is that the goal is not simply to gather feedback, it is really to create that safe space for shared decision-making. And members of the PCAB help shape programs, policies, priorities related to perinatal care, and allowing their perspectives to inform how hospitals design services, address barriers, and improve patient experiences. And a key part of that model is that lived experience, which is intentionally centered. So many PCAB members are individuals who have recently navigated pregnancy, birth, or postpartum care within the health system, within the region where the health system sits. And that helps to ensure that these discussions are grounded in those real experiences, real challenges, and those real opportunities for improvement. PCABs also intentionally include community-based organizations and community individuals, other trusted community voices who often understand those barriers that hospitals may not always see, or be able to maybe connect the dots, right? Provide a little bit more context information. And then importantly, these conversations and these partnerships are structured and supported. If you want to go to the next slide. And so what makes PCABs different from maybe a traditional advisory model is that power. So with PCABs, we see that shared power looks like what we mentioned a little bit, but majority of the PCAB members have lived experience. They are really those patients and community holding that majority representation. They co-create and design agendas. They really review data transparently, thinking about storytelling as a decision input, influencing those real decisions and co-creating and co-designing those solutions. Members are compensated. Meetings are trauma-informed, and really thinking about, how do we support institutional leaders to be held accountable to their actions and to the decisions that are being made. I'm going to go to the next slide. This is just a visual way to kind of see how PCABs maybe might differ a little bit from traditional engagement models. And so we see, or we often hear, that many systems might stop at the consult and involve stages. So inform, consult, involve. And PCABs are really built for co-leading. So taking it even a step above, collaborate. How do we co-lead and shift that power out of our institutional hands and into the community and patients and community leaders' hands? Go to the next slide. And so PCAB members intentionally represent diverse representation from the community. So as I mentioned, birthing people who reside in the region who have or will have a perinatal or birth experience at the health system, support persons, parents, grandparents, spouses, significant others, close friends, thinking about community health workers, midwives, and doulas or doulos. And then who are those other voices in the room? Faith-based leaders, local grassroots or community organizations, social service organizations, community leaders, and then hospital leadership. And Christine will talk a little bit more about the representation between hospital leadership and community in some of the later slides. But really what we're emphasizing here is that lived experience, either directly from those who have given birth or will give birth, or those who support them, who can share their lived experiences, thinking about diversity across race, geography, language, experience, thinking about how compensation can remove barriers, and that might look different for different communities, might look different for different hospital systems as they navigate this new approach. And really thinking about, how can we strengthen the PCAB members for that long-term engagement? What support, training, education, guidance, coaching, or mentoring can we give to them along the way? So I'll hand it off to Christine now to talk to you a little bit more about our work with the hospitals and really the setting up and the logistics and structure behind some of the PCABs before we talk about what were some of their outcomes.
Absolutely. Thank you, Adelisa, for really giving that great introduction to PCABs. We'll talk about the hospital preparation. And as Adelisa just mentioned on the last slide, and as you can see from the picture, that was our representation from Capitol Health, their PCAB. We'll see more pictures along the way. But with the hospital representation, that was a super important, component as we think about the PCABs being the majority, being there as the diverse examples of those who have given birth, as Adelisa mentioned, our service workers, those who are always hitting the ground running around these different topic areas, but to have maternal health leadership present, to have patient experience at the table also presented. Those are just some of the many that were part of the conversation or helped to really co-create this model with us in collaboration. So for the hospital preparation piece, the sites that we worked with for the pilot, they met on a monthly and ad hoc basis. So there was a lot of planning that went into this intentionality of creating not only the PCAB model at their hospital and at their facility, but then also thinking about planning. And in terms of those planning conversations, and I'm jumping ahead to a couple bullets down, but we talked about how to build safe space environments, how to honor some of what you all mentioned in the chat earlier about the historical traumas that our birthing individuals and those service workers and birth workers may have faced in their communities. Also, really, when we were in preparation for the different types of materials or agendas or even applications to become a PCAB member, thinking about health literacy levels. For all the materials that we co-created for the PCABs, we made sure that the materials were at least at an 8th grade reading level, if not somewhere between a 6th to 8th grade reading level, depending upon the site. We also reviewed area data and external services and resources and hospital assessments together. So this is a triangulation of looking at the needs assessment for the area. Also looking at data that was available not only for the state, but then for the region or for the county. And a third layer to that, a lot of you all have heard us talk about team birth more widely across the state, where we talk more about shared decision making and what that looks like at the hospital level. And both of these sites that we worked with had the opportunity to integrate this tool at the same time of sharing out this data in real time with their patients. So we got to hear about the patient voice and experience, and the PCAB members also had the transparency to hear about that data as well. We had the development of core materials, so anywhere from your application to your acceptance letters to your identity or protecting identity types of forms. We had all of those different types of components really laid out and worked on, once again, the language, the literacy levels, making it accessible, whether it's from electronic form or even a printout form that could be available. In terms of forming the PCAB membership and recruitment, really thinking about diverse strategies. The both of the sites that we worked with for the pilot, they had the opportunity to have really strong partnerships with a lot of different community members and community partners. But we also had the opportunity to have one-on-one phone conversations and interviews to learn about the interests of those who may want to work on this PCAB and their commitment to this. And then lastly, the co-creation of agendas. The meeting space planning, really being intentional around that. If you look at best practices around the United States or even in New Jersey about space planning, we're thinking about meeting community where they are. So where are the best accessible places, whether someone's coming by car, by bus, by Uber, even walking, that folks can make it to. So we really were cognizant of really planning a space that worked well for the PCAB members in the pilot. And so we'll talk more about this as well, really customizing it. So looking at the PCAB framework, if we look at the nucleus here, I want to really bridge in the conversation of what you all put in a Mentimeter conversation or in the chat from earlier. It's a lived experience and it's a trust building, right? We're thinking about how to really advance that, how to push those really those center and central themes forward. We know that a lot of times that from historical concepts, from even more recent concepts, that trust can certainly be broken. So how to build trust even in some of these scenarios, and also honor the lived experiences of the PCAB members or of any community members that sharing their story, their time, their experience, and their expertise. From that, as we move away from that nucleus, we also have shared power, really being the theme of our message today, how to really thread through that shared power, shared decision making, really valuing the relationship and as someone also mentioned, I'm pulling from the Mentimeter, but eliminating the hierarchies that exist, right? So how can we have this equitable framework where relationships are being honored in a space? And that also goes into transparency. So whether it's data that's being shared back, decision making around maternal health at the hospital level and maternal health leaders really exploring and sharing more or talking about the decisions of why it was really a transparent way of sharing feedback and information in real time. And then lastly, as we get to that outer layer, we're talking about policy change. And we know that when policies change, it really dives into our whole framework here. It can affect the change of the whole hospital system, the units, even the external communities and neighborhoods and really catchment areas where the hospitals do exist and the health systems exist. So that looks at program design, the accountability, of course, the resource allocation, and then also, once again, bringing trust back into the fold. I don't want to leave off at the very bottom of the screen. You see childcare, you see data transparency, compensation. These are some of those external or social determinant factors that were built into this particular grant and this work in the pilot. So that means that there was a certain funding that was allotted for childcare. There were certain monies that were allotted for transportation, just thinking about PCAB members in that region, making it as accessible as possible and transparent for those who are showing up to the conversation. Now, this looks at a timeline on our next slide. And while we won't go into every factor from top to bottom, it's just really a schematic to look at from 2024 to 2025. And even now, as we still are having conversations with both of the PCAB pilots, a lot of the work that had gone in. So you can see that there was a benchmarking survey and a landscape analysis that was complete. That was one of our very first deliverables. We looked at the data representation in the area from the maternal health factors, from the social determinant health factors, and even the different resource providers and partners in the area, and made this large comprehensive list. And so really just thinking about how that was a tool to use for the different sites that we were working with, and then also even future forward now, how it's something that they even use to this day. For the benchmarking survey, we looked at how birth equity and health equity was walked out at each of the hospital sites. At the time, we had a 71 count survey that looked at the hospital profile, the maternal health services, as well as the data collections and and social determinant factors. And we're able to share the survey out with the sites that we worked with, as well as had in-person interviews and touch points to learn more about the systems and about the hospital. So just going down the list here, leadership and advocacy trainings. We did a community partner assessment so that the PCAB members could really dive into what their priority areas were. So many different pieces on the timeline, and we would love to talk offline more about some of those more granular items within this timeline here. One is prep, and we have one for sustainability as the PCAB members continue to move forward. So you might say, what changed because of the PCAB work? And there were so many changes, once again, that we could list out. For Hospital A and Hospital B, we have, I'll just name a few. For the Hospital A, we saw that there was a nesting room that was built. So right with one of our first conversations with this particular site, they talked about how NICU parents and how conversations and spaces where NICU parents felt like they needed more ways of having this intentional space and collaborative space where they could be together and have more education, have a safe space to just have that be accessible to them. And so they made a nesting room at their facility that was designed and really had the input of PCAB members. They also talked about during their meetings how there was low doula participation, or there was low doula engagement, I should say, at that particular site. And so they created doula open houses where doulas were invited to the hospital site from a virtual standpoint, as well as in person, and had the opportunity to bridge more conversational gaps. I'm moving on to Hospital B. Some of the main things that we saw, there's so many, but a few that we'll list here is the maternity care and tour videos. So one of the first things that this particular site looked at with their PCAB is the way that they were sharing out messaging around their maternity services. They were also looking into education around their maternal health services, and they were able to co-create and really get feedback to be able to guide some of the language that was shared, even think about different translations that should be offered for these videos, accessibility. And now this particular site, they have different maternity apps, they have different websites, and just different ways that individuals can interact with this information. Another one is a biannual community baby shower. This site was already having this really wonderful, illustrious baby shower biannually every year, but just even more involvement from the PCAB members, tabling, talking, support. We've seen it all. And so you'll hear more about it from our PCAB members about that really deep impact. And then the PCAB members from both sites, they'll share more. I'm just going to give a little bit of a feeler, but one of the sites have chose to look at maternal mental health as one of their larger priority areas. And another one is looking at partnerships. So that's just a little bit of a teaser for later, but I'll save that for the PCAB members. So looking into PCAB sustainability, this is also a huge focal point because as the PCABs are created and as they are strengthened, folks are really co-creating in a safe space. What's the sustainability behind that? And a large part, as we mentioned earlier, is making sure that our PCAB members, our community members, have a seat, not only a seat, but a leadership seat at the table. So different chair, co-chair, secretary, coordinator roles were complete and provided and developed for the PCAB. And as you can see, we have some roles and responsibilities here, really just showing that we could co-create, but then also have some sense of leadership and that power shift back in the hands of our community members and those who are doing the great work in community. All right, and to that, we got leadership development here on the next page, and this is when we get into a few of the beautiful pictures. For this particular work and on this particular pilot, we had the opportunity to gather twice as a collective. That means that both of our PCABs from Hospital A and Hospital B had the opportunity to come together as one unit. And some of you all were in the room as well as we met. We had different learning sessions and breakout sessions. And as you can see, we're hosted by our PCAB members here on the screens. So we're looking forward to hearing from some of our PCAB members today a little bit later. I want to bring back, as we talk about leadership development, something that Adelisa mentioned earlier, really creating opportunities for professional development as a part of that as well. Now, next, we're going to get into the evaluation piece. And so, with the PCAB in mind, we thought of different ways that we can evaluate not only the success, but get the feedback in real time from PCAB members of their thoughts, from their perspectives, and really help us for the future to think of different ways to improve PCAB and different types of community action-oriented programs and solutions over time. So there were a few different components to this evaluation. We looked at advocacy, communication, sustainability, of course, diversity, equity, inclusion, leadership, and engagement. So on the next few slides, we'll break out what evaluation looked for the PCAB. So we provided a list of about 15 different questions for the PCAB prior to their start, or at the beginning of their start, I should say, and at the end of our grant period. And this is looking at our initial evaluation. One of the questions that we were really concerned about was safe space and how PCAB members perceived that. So this first question asks, did you feel that the PCAB meetings were a safe space where you could speak freely and feel respected? And so we see that the majority of PCAB members who answered on this survey, and this is looking at aggregated data of both of the sites conjoined. This is also voluntary data from the PCAB members. We see that the majority of that 83% said yes. And then also a 16.7%, we saw that said somewhat. As we go into our post data, we see that 100% of those PCAB members who responded voluntarily to the evaluation survey responded that they did feel like they were in a safe space. So we did see that growth over time of getting more comfortable with the space and having that more safe space perspective being felt and being seen throughout. We're also leaving a couple of quotes here throughout our evaluation that we have here. One being the environment allowed me to speak freely, share my thoughts, and I feel like my voice was valued. So we're going to leave a couple of these really great substantial quotes to support some of the data that we got back here. So feel free to take a peek at those along the way. Another question that we did ask, and this is looking at post-evaluation. As a PCAB member, I feel more confident that I can make a difference within the hospital and or for my community. And so we see that PCAB members responded that they, yes, felt very confident or confident by the first 2 years of working together on these projects. And we can see below, I truly feel like we're making a difference and the voices of the community members are being heard through us. And then another question here. Do you think that non-hospital members of the PCAB are empowered to make important decisions in hospital policy, services, practices? And for those who responded, majority said yes. And for that 29% even said somewhat. So just looking and tracking this along the way, as we can see up top, PCAB members really expressing here of a unity in purpose. Those are really some of the words that are standing out to us as we're thinking about this endeavor being collective and really just breaking silos once again. We have a couple of different quotes and we'll share them with you after this program as well, but just looking at engagement, thinking about the policies that are changed or will change, the value of the space, being in a supportive space. These are some of the words that certainly jump out at us as we think about those reflective moments. So not only for our PCAB members, we also saw a large impact from our hospital leadership members as well. We put a few of their quotes because they had a evaluation that they answered as well. So we see here that insights from the racial disparities and differences in hospitals, that's one of the main key focuses that they learned. They also said that awareness around perinatal barriers such as food security or around the essential furniture that folks might need, like a crib, that was one of the larger conversations that hospital had, was extremely important. And I love how this one at the bottom says clear and effective communication. So once again, some really strong feedback from our hospital leadership as well as our PCAB community members that attributed to this work together as a collective. So with that, Adelisa, I'm going to pass it right on to you as we get into our lessons learned.
Thanks, Christine. And so what did we learn from all this? We really started working with the two health systems almost 3 years ago now. So we've had an opportunity not just to work with them for those 2 years, but then continue to learn from them over the last several months. And then as we begin to expand to additional health systems, I'm really learning from them as well. And I think I'm going to answer a couple of the first initial questions that were in the chat box just because it fits in really nicely with some of the things on this slide. But I know there were others which I'm happy to pose to you, Christine, as well, just so you have an opportunity to reflect on some of these questions. But, really thinking about what worked well was really thinking of relationships before deliverables. As you might have seen on the timeline Christine shared, it really took about a year to begin to develop those relationships before the PCAB was able to move to what were some real actions and impact that we can have. Not to say that they weren't working on things in the first year, but we did see those relationships grow significantly over the course of that first year, especially as the PCAB model was new to both the health system and the community in a different way than maybe they were used to interacting with the health system or interacting around maternal health with the health system. So it did take a little bit of time to make this space safe, to really feel like they knew one another, that they gave enough time to hear about experiences from one another and their perspectives, and that really allowed them to then move into some of these deliverables or actionable things that we wanted to do. Recognizing that storytelling surfaces those root causes, which again was so important in that first year, was to allow that storytelling to really drive experiences, conversations, and decisions. Sometimes it was one party not recognizing what that experience was like or what those barriers were. They might have had an understanding of the high level barriers, but didn't really understand the intricacies and complicated and complex environment in which they sat in. And then being able to bring that back internally and in the next meeting, circling back to it at times, and both in part of the hospital being engaged in doing that or the PCAB members asking them, or holding them accountable to what's the update, what's going on. We think about how compensation really enables inequity, seeing PCAB members, their lived experience equal to professional and clinical experience, understanding the contributions that they make. And so compensating them for their time financially when able to do so, and is what we suggest to really help allow them to do that. But also understanding, if compensation is not something maybe all health systems can do. And so thinking about how are we having those conversations to demonstrate the value while also thinking about what barriers exist to prevent their participation, and how can we support that if not financially being able to do so. Thinking about transparency builds trust, which goes a little bit into the data part, but it intertwines with some of the what's hard that we learned. And so there was some institutional apprehension, both in terms of transparency, in terms of just weren't used to interacting, to this high level and with this kind of authority with community members or patients, and recognizing institutions move slower than the community, right? Community workers, community voices, community leaders, patients are often ready to jump into the work. They're excited and committed and passionate about improving things, but recognizing there is still a lot of red tape within the institutions or just different conversations that have to happen before a change is made. And so everyone had to really learn to talk about that space and navigate within it. And that learning to share power, that power sharing feels uncomfortable. It was a learning curve to really better understand what sharing power looked like and how do we do it and how do I give up that control. And a part of that was one of the questions that we received was around what does the hospital data include? And so it looked different for each facility, but that grew over time, right? We really supported the hospital in sharing data transparently. And so in the beginning, it was around just kind of a deep dive into what's publicly available first, as we wanted to make sure that PCAB members, a lot of them had never been in this healthcare space in this way, right? They were patients or community workers. And so also providing a level of education of how do I understand this data? Where does it come from? What does it mean? What am I supposed to do with it? And so educating them along the way. Both institutions tended to start on that side of like what was some public facing data around maybe like Leapfrog or the hospital scores and ratings, to use that as a mechanism to walk them through some of that education. And then over time, more transparently sharing maybe internal hospital data that they had not yet shared publicly, or there's a lot of data that they collect, and so really being able to talk with the PCABs about that. And sometimes that transparency was outside of metrics and measures. What other hospital data did they share? Sometimes around demographics or data around impact, and sometimes that transparency was around why couldn't they do something, right? If there was a recommendation or a strategy for a suggestion, an idea, and it wasn't going to happen or it couldn't happen yet, transparently sharing about why? What was the red tape? What was the barriers? And what can we do about it as a PCAB that most we saw the PCABs really wanted to be involved and they wanted to support and they wanted to have some real honest conversations around that. We also thought a lot about sustainability planning, and it's hard. It has to be designed early, and again, it's new for a lot of the hospital systems, and so having to navigate sustainability early on while also just introducing this new model of care at the same time was a little bit of competing priorities at times, but really recognizing in order for this to be successful in the long term, we had to have some of those honest, transparent sustainability conversations early on. And then acting on community input consistently. It can be hard to do on that consistent level because that's what they expect, right? They're there, they're contributing, you ask them to contribute, and they want to contribute, and they want to know why things aren't happening, and being able to really consider how do we act on what they're telling us, and who do we need to speak to in order for that to happen. And we were also thinking about what were some future considerations. So meeting frequency, which somebody did ask about if the PCAB meetings were held during the day and where they were held. Ideally, the PCAB meetings are held at a time and a place that's most convenient for the PCAB, non-hospital PCAB members. Both hospitals ended up doing different surveys to really consider for the PCAB members at what time and day would be best for them. Sometimes they would switch a month or a quarter just for whatever reasons. It was not a good time at the same time. One site consistently had it in the evenings because that was what worked best for the birthing people and the community leaders, community health workers in the room. And so it should really be what's best for the PCAB members, and to have the PCAB members, especially once you get those PCAB chairs and co-chairs, to really lead a lot of those conversations. So hopefully that answers that question. And where they were held, same thing. Both hospitals did ask the PCAB members what were their preference. So the first meeting was held at the hospital just for really just ease of having that first meeting. But after the first meeting and then ongoing throughout the year, really asking the PCAB members if they wanted to move locations, if they wanted to host, if they wanted to think about a community space that they might be more comfortable or felt safer or in. And so having that flexibility, and some of the hospital leaders having to have those conversations about, can they go off sites if that was what was best for the PCAB. So hopefully that answers a couple of those questions that we saw come in. I think there was another one. And so thinking about plan for on and offboarding new members was also something that is helpful to plan ahead of time. We were doing a little bit of it live, but thinking about, we planned a lot of this in conversation, but maybe having something in writing can be really helpful. That brings a layer of clarity and consistency to the PCAB members. And thinking about, there was a question around how do we build psychological safety for members who don't feel like experts in the traditional sense, whether professional title or academic setting, so they can confidently share their insights. And a part of that was thinking about that plan for on and offboarding new members, including hospital members. Like, how can we provide a level of training, education, and support and about these concepts to everyone in the PCAB, including the hospital members, because there was a variety of comfort or expertise with that. Some have heard about safe spaces before and what were some of those grounding concepts. So, we did provide a certain layer of education and support to the hospital leadership, and then in turn to the hospital leadership in partnership with the PCAB members to really build in some opportunity. Christine mentioned those ongoing opportunities to further PCAB members' comfort, education, whether that's training, to really, think about some of those concepts. So I think those are key. We did that, because we were a part of this project, but it doesn't mean that you as a healthcare system or a community organization or what be can, think about how do you further your own comfort, education, and training in that space. Christine, I don't know if you have anything to add to that.
Yeah, I wanted to add a few pieces, and I'm looking at the time as well and be cognizant. I'm thinking that for that relationship and the storytelling piece that you're sharing, and I know that we had a couple comments in the chat. I'm sorry I didn't get to see those just in sharing mode. But both of the sites conducted really unique processes where one had a deep dive over a few months of looking at their hospital's needs assessment, where they were actually able to split it up into to divvy those different components and to come back to the table and to find the priority area that spoke to them, their communities that they serve, as well as them as a community member. A second site was able to really look more deeply and look at priorities by engaging with a resource list that they made. So we know that there are so many different listservs that are available, but they made a really unique listserv that did not maybe encompass maybe some of the community members or leaders that they did see like frequently noticed. So it was a way to really engage that way, I think, of being purposeful and intentional that way. From that safe space building, I'm kind of like cross-secting some of the things that you mentioned, Adelisa. Definitely with the trainings that the hospital members had, I think that really helped to open up some of the engagement around safe space building. We actually had some community agreements as well. So coming into the space, some of the respectful type of, of course, not speaking and talking over folks, or just like some of those agreements that you would have like in a group of working together with different individuals, but also asking for feedback from community. Is this meeting the standard of the meetings? Are there things that we could add to this list as an agreement that really helps to really create the space and set the tone for what we're trying to build and cultivate, as well as icebreakers and just different types of activities that got everyone focused and engaged. So those are a couple different layers into some of what you just shared, Adelisa, but I just wanted to fill in some of those pieces as well.
Yeah, and just to add to what Christine said, because I see a lot of the comments too that are coming in, we hope to get to all of them, but um, we are doing exactly what we are suggesting others do within the PCABs, is really just turning to the community to share out and to learn from. And so really appreciate all the comments and suggestions that are coming in. We don't pretend to, be the complete experts in all of this, right? It was a pilot that we learned a lot from, and we're expanding to more sites, and we want to make sure how can we continue to strengthen this. So I do appreciate the kind of really detailed comments and suggestions folks are leaving in the chat box, because it's really helpful for me and Christine and the rest of our team to be able to see those, understand them, even reach out if we have more questions. So please keep them coming. I know we might not get to them all, but there are really great comments in there. All right, to help keep us on track, though, we're going to move back to the slides. Maybe just looking at the time, I'm just seeing where we are on track here. We might consider, we may not do this activity we were going to do for this particular slide, but just want to leave you with some thoughts. If you were designing a PCAB, or if you're just thinking about how can we start or better incorporate community voices, these were a lot of questions that we were thinking about along the way. In addition to some of the things you heard us talking about, but really thinking about, and in talking with both healthcare systems about who should be at the table, what voices are missing. Of course, we want to have the voices at the table that we maybe interact with a lot, that have a lot of value already to us, but who else can we bring to the table? And that included doing some of that landscape assessment. Who is everyone in this county or community who's working in maternal health, so we can have a better understanding of who are we interacting and engaging with, and who maybe are we not doing that so much with, but that has something to say. What voices are missing, and how do we include them, if not in this first iteration of the PCAB, but thinking about terms so that we can keep those voices fresh. Who's experiencing harm, who holds that informal community trust. So again, thinking about your atypical community leaders who maybe aren't so experienced in healthcare or maternal health, but still interact and have a lot of experiences they can share. What principles will guide engagement? We talked a lot about compensation, trauma-informed facilitation, transparency, and then thinking about how you will share power and measure success, recognizing that will look different at different facilities, but will you use a voting structure? What's the budget here? How will that impact your ability to carry this out? Policy authority, really understanding the layer of power and decision-making authority that you're giving to this PCAB, and hoping they give back to you, and what metrics matter, right? We want to be able to really understand, is the PCAB working from the perspective of the PCAB members, but also what is the impact that the PCAB is having on maternal health experiences and outcomes within our community. So just some thoughts to get you guys thinking, but we did also want to just take a moment to share, you can go to the next slide, Christine, to share some pictures from our PCAB members in action that really highlight the many initiatives and events where PCAB members, including hospital leadership, showed up for and supported each other outside of their official PCAB activities. So a lot of these pictures are that. There are additional things that, as those relationships grew, they started to show up for one another, which in turn allowed those relationships and trust to continue to flourish. If you want to go to the next slide, I think we have a couple of pictures there too. So some activities they were doing. That one in the top left-hand corner is the food packaging event that we talked about, which was a PCAB members that brought in the maternal health leadership, supported and volunteered their time. So just lots of opportunities for them to grow those relationships. If you want to go to the next slide, I'm going to hand it over to Christine to do one final activity before we open it up to Q&A.
Right. So thank you, Adelisa, for getting us close to the wrap up. We have a reflection activity, just one more for you. We're looking in for actionable strategies, right? So we want to hear about this commitment to connection, we're calling it. So what's one step that you'll take away maybe from this conversation, or maybe something that you're already doing really well with communities that you serve, that you'll use to strengthen community connection? So feel free to use the QR. I think we have the information in the chat, a couple of different ways to enter this Menti, and we'll do this just for a few seconds to take a peek and see what your commitment is to connection. So I'm gonna stop share and I'm gonna reshare. And I'm realizing that you might not see the question just as of yet because I need to share first. So let me do that really quickly. All right. But thank you all for brainstorming that while I am pulling all this good stuff up. Oh, okay. So I won't be able to present this one, but if you like to come off mute, if you like to plug it in the chat, feel free to do so. We're talking about your commitment to connection. What's one piece or one takeaway that you'll use to strengthen the work that you do in community? So feel free to share in the chat. And if anyone would love to come off mute, we would like to hear some of your suggestions or some of the takeaways. And I see the chat lighting up. Move at the speed of trust. We'd love that. Continue to show up for meaningful conversations. Absolutely. Evening and weekend clinic hours. Absolutely, it's going to be helpful for those that you serve. Wonderful. Relationships before deliverables. Exactly. Yeah, that's one of the pieces that was our takeaway as well. Really taking the time for relationships. Relationships take time. So really being intentional with that portion. Um, Review community agreements. Yes, yes, yes. We need that. Just taking a moment, pausing. Is this really going to meet the needs of our conversation in the space that we're trying to develop? Call people in. Yeah, absolutely. So whoever we don't see at the table, those voices that are not present, really taking time to reevaluate and to think, and to consider who's not there and who can we call, what type of experts do we need? So I'm pulling up our very last slide. This is our QR code, of course, for the Quality Institute, but you'll get more information about our shared decision-making programs. As Adelisa mentioned, this is the first of many. We're looking to continue to scale this work, and you'll actually hear about more materials and things that we're developing to really support this first pilot that you just saw of some of that work. So we have a lot coming upstream, so please do stay connected with us. We would love to hear your thoughts with any types of iterations that you may have had across the state and beyond with the models. But thank you so much for your time and attention. And we have a lot more to share today. But with that, I think I'm going to pass it on back to Max, looking at the time and just thinking about the program coming up. Thank you all.
Awesome, wonderful. That was, I mean, I don't know about you guys, but I was blown away. And I actually know the work that we're doing here. But I actually would like to take the time before we transition. I wanted to highlight the work that some of our PCAB members have done. So this conversation will focus on our next conversation will focus on how prenatal community advisory boards are helping to strengthen relationships between community and healthcare systems, and what it looks like to have, what it looks like to move from that type of engagement to true practice. And so I am pleased to introduce our moderator, Peter Bullock. Peter is a husband, father, and a certified doula. And he's the founder of Hey Black Dad, where his where he is leading a movement to transform the journey into a fatherhood and elevate the role of fathers in maternal health. Truly amazing work. His work focuses on equipping men to show up as supportive partners as well as engaged parents. So ultimately strengthening families and improving overall outcomes. We're also joined by an incredible group of panelists. We have Karina Gridnovic, Yolanda Haddon, Jennifer Jacobson, who will all be sharing their experiences participating in PCABs and reflecting on how these partnerships can drive meaningful change. So, with that being said, Peter, the floor is yours.
Thank you so much. How are you today? I hope everyone's doing well. Everybody's doing good? Yeah. I definitely want to give a round of applause and some celebrations to Adelisa and Christine for just naming what it is that PCABs do and really out laying out why it's important and also mentioning the progress that's being made, right? Talking about the progress and just stating where we are going to be going with PCAB. So, as mentioned, my name is Peter Bullock, and I will be moderating this awesome panel discussion. So, thank you to the moderators. Thank you to the panelists for agreeing to participate in this. I do want to get started with the first question. Um, well, it's not even a question. Would you be able to introduce yourself and to share what motivated you to join the Perinatal Community Advisory Board and why this work is important to you? I can start with Yolanda.
Good afternoon, everyone. I'm Yolanda Haddon. I serve as a member of PCAB for Capital Health. I joined this work because I'm really deeply passionate about the health and well-being of women, children, and families, especially those in communities where their experiences haven't really been equitable of care. I'm a mother of two, so really that is where, for me, where everything started. I experienced firsthand how important it is to feel heard and to feel supported. I understand the journey of pregnancy and childbirth, and sometimes it's a little uneasy. There's a lot of questions, a lot of uncertainty. So it's important how meaningful your voice is about your own birth experience. So for me, those experiences stayed with me long after I left the hospital. I also do a lot of this work with my sorority as a community-based organization. As we work on our women's wellness initiative, we've partnered with Capital Health with many different maternal health. So for me, it's vital work, it's important work to make sure that all women or all birthing parents have an opportunity to be heard and have the patient experience that they deserve and need.
Thank you, Yolanda. Jennifer, would you be able to share your perspective on that?
Hello, everybody. I am Jen Jacobson, and I have been part of the Penn Medicine PCAB for about a year and a half, coming up on 2 years soon. And I am also a mom of two boys and also have a background in mental health counseling. Both of my children were born at 29 and just under 32 weeks, so we had spent quite a significant time in the NICU together. And really, after experiencing many of my own perinatal and maternal health challenges, and really being inspired by the support and care that we received from the doctors and the nurses in the NICU, I'm really just grateful to be part of, the PCAB and continuing to work with other incredible individuals who are also really passionate about helping improve perinatal and maternal health. I've worked a lot with people in crisis, and I'm a really strong believer in prevention and early intervention, and that really supporting mothers and birthing people is an extremely important part of achieving better health outcomes for the children that they are raising. I see it like the metaphor of putting your oxygen mask on yourself before helping others when you're on an airplane. And here in the PCAB, I feel like we are focusing on putting the oxygen mask on moms or birthing people so that they can better help their own children. And so it's really the life cycle here we're working on.
Thank you, Jen. And finally, Karima.
Hi, I'm Karina. I'm with Jen at the Princeton PCAB, somehow coming up on 2 years already. I had both of my kids there, And I was asked to join by my OB, and I thought, oh, cool, a chance to share some opinions. I'm always happy to do that. But little did I know how meaningful it would be. I think there's so much I didn't know, and I think this is probably true for most of us about pregnancy, birth, taking care of your children. I mean, there's just so much. And I think part of what can be challenging is stigma, feeling like you're alone when things get hard, not sure, like not being sure how to handle certain feelings or what to do. And I think transparent conversations and solutions that we come up with as a community are so important. So just really excited to have been part of this and continue the work.
Thank you, Karima. And as I reflect on just how I got started on the PCAB, I'm over at the Capitol Health one with Yolanda. And as you said, somehow coming up on 2 years, it was so fast that we've been doing these things and just making different suggestions and really building community. I really feel like I have a relationship with each member of the Perinatal Community Advisory Board over at Capitol Health. And it took time, and really establishing community really helps with being able to provide insight to the policies and what's taking place from an authentic point of view. Everybody at the table has a level playing field. So one of the questions I'm going to start with is, how can lived experience help to shape better policies and practices in the hospital? Whoever would like to start could start. All right, I'm gonna just popcorn somebody. Okay, here we go.
I think, as we all know, that people come into hospitals from so many different walks of life, so many different cultures, and as society also continues to keep evolving, it's, really hard for hospitals to meet 100% of healthcare needs to 100% of their patients. But really listening to lived experiences of, not just patients, but also healthcare staff, like someone had mentioned in the comments. This is how hospitals can better understand how their patients are perceiving their health care, what are barriers to access of care, identify where there are gaps and where improvements can be made to increase that likelihood of meeting the diverse and evolving needs of people that hospitals serve.
Just to piggyback off of that, I think Christine had mentioned this earlier, like data is important. We need numbers, we need to be able to measure things, reports, but those numbers can never fully sum up like a person's experience. And I think also a lot of times, perhaps somebody hasn't met somebody before from a certain background, or we make assumptions, and coming in as somebody who's a LGBT person, who's married to a woman, who might be invisible in some ways. When I like enter a certain space, I notice the gaps and things. And so I think it's important to be able to share authentically what something is like for you, because people can mean well, but still not know what their blind spots are. And if they're willing to listen, I think it's a really powerful thing to be able to like guide them on making better choices and creating support systems.
Yeah, I just wanted to add that I feel like lived experiences bring the human side to the data. So when the hospitals look at their data, I think that's what lived experiences do. It brings that data more personal. Um, it really helps, as hospital tracks outcomes and metrics, they're not necessarily capturing how a patient felt and what barriers they faced and, what could have made their experience better. So when people share their stories, it really uncovers the gaps that might otherwise go, whether there's communication, the cultural sensitivity, or belief feel heard during a very vulnerable time.
Yeah, you definitely bring a very great point to that, Yolanda. Storytelling really helps to surface those root causes, and that was actually mentioned or listed as that was actually listed in one of the slides that Adelisa was speaking on. And Karim, you said something about the gaps, right? And how people can mean very well, but they don't know what they might be missing, right? There are going to be blind spots, right? That leads me to my next question. Would you be able to share? I'll start with you, Karina. Would you be able to share an example of change that your PCAB helped to make or is in the process of making to improve maternal health care, maternal child health care?
So I will say, um, I shared something in the very first meeting of our PCAB, and I just shared it as a story to, to guide the work we were doing. And by the second meeting, and I'll share the story in a second, they came back and they were like, we implemented a change. And I was like, shocked. And basically, it related to inclusive language. When we were calling, everyone rushing to call for lunch when you're at the hospital, the worker on the other line was like, oh, what will your husband be having? And I have a wife, and it didn't ruin my experience at the hospital, but it was disappointing. It was a bummer and an otherwise like really eventful moment of my child's birth. And I shared that story at literally our very first PCAB meeting. By the second one, they had come back, and they were like, hey, just wanted you to know that we had like trained our staff and talked to them about just being more inclusive and mindful of things that they say. And I couldn't believe it. And that was literally the very beginning of our process. Since then, we've been working on other things, including like resources to help people navigate different things postpartum. But that to me was such a huge thing, even though it wasn't huge in terms of like policy, but it was so monumental that they listened and implemented a change right away. So shout out to them for sure.
That's so that's amazing, right? When we can see the change that we suggested just off of an experience that we had. Um, it makes me think about some of the changes that were brought on at the perinatal, at the PCAB over at Capitol Health. I'd like to know if Yolanda would like to speak to any of those changes as well. And then I'm gonna hop over to you, Jen.
Wow, that's a long list for us because we would tackle a lot of different things. I think for me, I think for me was understanding that there was a full scope of needs for families, right? So it wasn't just the prenatal experience. It was looking at we had mental health, we had environmental, we had social. So we recognized that we needed to improve partnerships with other community organizations that would provide those services. As we talk about food insecurity, we want to make sure that families had that. So, we had started developing a community organization list where we started listing different organizations within the community that would offer various different services. And in that, looking at how we can sustain such a list, but also and develop partnerships with those organizations. So in March, we were able to have a collaborative event with the Greater Mercer Public Health Partners, where we really began to have those conversations about what resources are in our community and how we can connect those resources to our birthing parents and making sure that our families have everything they need within the scope of what they're going through. So not just during pregnancy, not just during childbirth, but once they go home, and what does that look like? So for me, the experience at Capitol Health has been that they've been very responsive to the feedback. They want to develop those partnerships. They want to improve outcomes. So for us, it a lot of times it comes off. We'll have like a list of things that we would suggest and recommend, and we would get back together and hear how those things were supported by leadership and subsequently it's implemented, or we see the product of the conversations that we're having. So it's really impactful to see the hospital respond in the way that they have been, and wanting to and desire to see those outcomes move in the right direction.
Thank you. And Jen, what would you say to that question? Can you share an example of a change that your PCAB helped to make or is in the process of making?
Well, first, I just wanted to take note how incredible it is to hear about the Capitol Health PCAB experience and where there are parallels to the kind of work that we're doing. As Karina was saying before, we're similarly working on resources and how to connect mothers and birthing parents to maintain their health, to work on their wellness after they leave the hospital. But another thing that comes to mind is early on, we were discussing how it can be a very isolating experience in the NICU. The hospital has great private rooms, which is really important. But also, when you are a NICU parent, and especially if you are in there for a significant amount of time, it can feel very isolating and alone, especially if it is your first birthing experience. And so we discussed, possible ways to connect parents together without the challenge of violating HIPAA and things like that. And so, collaboratively, we came up with a potential solution. And when the hospital leadership had told us that they had implemented kind of like a signal, outside the door that could let other families know that they're open to connecting or speaking about their experience or getting support from one another, we then also discussed the potential challenges with even just that and making sure that, if somebody has that magnet or that signal on the door saying like, hey, I want to connect with other people, and then nobody shows up, what could that do and how could that affect that family, and how can we prevent, creating more harm and making sure that people are feeling supported in that moment. So kind of, starting to think about what would the backup plan be to make sure that that person is supported. Because, it could also be kind of a cry for, hey, I'm really needing to be with other people right now in this, and, don't want to just be alone in it. So it was really incredible. And things like that can make your experience in the hospital, a lot more bearable sometimes, a lot more, meaningful.
Thank you. And with that, I hear you say collaborate, right? A lot of collaborating has to take place to make it meaningful, right? So there has to be that level of trust between the PCAB and the policymakers and the decision makers. I heard, there needs to be someone in the room that is bringing in the information discussed and the topics discussed during those PCAB meetings that we would have. Based on your experiences, with the PCAB, what does it look like to share that power and not just ask for input or just be asked to do stuff or just being asked to provide information? But what's it really look like to share that power and in that co-leading space? And what does it really feel like to truly co-lead in this work?
Just to continue on with the example that I had shared, our PCAB is made up with so many different maternal child healthcare disciplines, so many community members with diverse professional backgrounds and worldviews. And really, it's where when we share our individual perspectives, we have the opportunity to build our collective knowledge about the topics that we're discussing. And, you know, rather than relying on individual input, we have the opportunity to identify where we align and discuss differing ideas and different challenges. And kind of like Karina was saying before, and identifying those blind spots and then really working together to drive more meaningful change to when we align on goals.
Yeah, and exactly what Jen said, but also I think it's like overwhelming in a good way. I don't want to speak for other people, but I think that it's a new experience, to sort of be an active participant as opposed to feel like, your health experience is happening to you. And which is what it feels like, I think, for a lot of people in, medical situations or settings. And I think also what's really powerful about it is that because you're not in an appointment, it just feels like people can come together, not like this was a medical professional or I am a patient. It's like we're just human beings with this context. Now let's share it and see how we can grow together without some of maybe the baggage or pressure that comes from being in the moment in like maybe a higher stakes medical situation.
I think sharing power is really about transparency. It's about trust and being willing to listen and act on what's being shared. I think it's important that PCAB is always have access to real information, that the hospital shares the data with the PCAB, and that transparency allows us to ask meaningful questions, provide the feedback based on that information, and actually see how our input connects to the outcome. It's important that the hospitals, it's important for us as PCAP that we understand the hospital's benchmarks, and really be part of those conversations about quality and safety metrics, right? So as much as we all want to, um, deep dive into this work, but we also have to understand the work of the hospital and what they're trying to achieve, as well as we bring in the community voice and we bring in lived experiences. We also have to balance that work with understanding what the work of the hospital and what they're trying to achieve. Um, and I think the most important piece is just making sure that at the end of all of that, that everyone who sat at the table felt as though that they were heard. And ultimately, we see the outcomes that both sides actually do desire to have.
Phenomenal points. All around the board, phenomenal points. Thank you. And I have one final question, right? So we talked about the past. We talked about how we got here, what it was that excited us to be a part of this board. We talked about the present, what we're currently doing, and what we look forward to seeing, and what's currently being worked on. But I want to talk about the future. I want us to imagine 3 to 5 years have passed. What would we be able to say has worked and is successful? What a successful PCAB looks like over the next 5 years? What would you say that will be?
I think for me, success over the next few years for PCAB is definitely just be the partnership between PCAB and the hospital. Um, Continuing to grow, as we talked about, that we talked about relationships, right? Building those relationships, building that partnership where it can continue to grow stronger, be more transparent and more impactful. I think on the hospital side, it basically is really continue to expand on integrating more of a community voice in their decision-making process. Um, Understanding that the feedback not only is heard, but can be reflected in their policies and their procedures, and really taking a look at patient experience, and other quality improvement efforts. On the PCAP side is basically building a strong, sustainable network of community-based organization and other initiatives, kind of similar to what Capitol Health is doing with the community baby showers, which happen twice a year. Like continuing to support those types of initiatives and continuing to build more partnerships with other organizations to help improve experiences and outcomes for families. So ultimately, the success would really be based on how well both the community, the board, and the hospital work together and partner together in this work.
Um, I think, I mean, those are all wonderful points, and I agree. I think something I was thinking about too is that a lot of times, and we see this in individuals as well, we get excited about change, we go all in, and then it's hard to sustain momentum or things fall off track. And, you know, I want to make sure that this grows and expands its impact and only gets more organized. I think it's really about how do we set it up for success in the future so it's not just like a flash in the pan of like, we did this thing, great, the work is done. The work is never done. We will adapt to some challenges, new ones will arise. And so it's really actively setting it up for success and structure for the future. That's what I really hope.
I agree with what both of you had expressed. And, I really think that since we are in such the early stages of making some, really meaningful, impactful change in the hospitals, tracking what the actual impact of those changes that we have implemented, and learning what is working and maybe where there are gaps in, what we're seeing. And really just making sure that over time, that we're continuing to strengthen the partnerships with community programs and community members by continuing to invite new people into the board so that we can continue to hear more voices and see different perspectives, and that collective knowledge grows so that we can really be trying to make the most, focused and meaningful impact that we can, to affect hopefully more people.
So thank you. Thank you so much. So I heard new voices continuing to grow and that the work never dies. It's never done. It's always going to be growing and there will always be a new challenge to combat. Uh Definitely want to say thank you to everyone on this panel discussion. And I'd like to open it up for any Q&A that people may have. Okay. If there's no Q&A, I would like
Someone
to.
has their hand raised. Sorry, Peter.
Oh, you got.
Erica. Thank you all for sharing your stories. I had a question just in terms of the community participation. I know you all are representing, but was there a particular number of community members that you were engaging? Like, I was just wondering what the ratio was in terms of your cabs and even your orientation to this PCAB with those members.
So just to hear again, you were asking if there was a certain number of community members that we engaged with, and then I didn't hear the last part of the
Yeah,
question.
so in terms of parents or representation, I know you guys are representing as community members. Were there additional community members along with you all, or were you the representatives at the table? And then in terms of your orientation process to the PCAB, was that something that was provided to you, and what did that kind of look like before sitting at the table with the members?
So yes, there was more. There were other members than just who you see here that's speaking on the PCAP. I'm not sure the exact number of everyone that we have on our board, but it was well over at least 10 different people, different or representing different aspects of the community, lactation consultants, new moms. Um, I represented fathers and very different organization, community-based organizations that were represented. I'll also let some of the panelists discuss who else was represented at theirs as well.
I agree. Yeah, we definitely had over 10. And it might be helpful actually if some of the healthcare quality folks chat about some of these the logistics because it ebbed and flowed, but we always had different kinds of people, like you said, Peter, different organizations, different faith-based. Then we had, one day there was a nurse from the hospital side, even like the folks on the hospital side. There was some consistency, both like patient side and hospital side, but there was also a lot of diversity, and folks would pop in just when they could, because it's also based, of course, on a commitment. And I think we all recognize, parents were all busy, but I know a lot of people tried to make the effort to show up as consistently as possible. I don't know, Jen, if you have anything. to share on that?
No, but in regards to, I guess, the orientation, one of the medical director of the NICU had reached out to me, but this was after kind of having built a relationship with them, having my children being patients in the NICU and having conversations about these sort of things ahead of time. So I guess kind of knowing that there's already that drive and that passion there, and when they explained to me what the PCAB was about, it was pretty easy for me to say that this is for me or if this wasn't for me. And that first meeting, I remember them really us going over what the mission statement is and what the expectations are and really our goals and how the goal was to be collaborative, that they want to hear everyone's voices and they want to make meaningful change in the hospital. And, it's really easy to be inspired by that.
And just to add some context to what the group was saying, in some of your questions was there was an orientation process, and that first year was really just building those relationships. But the first several months was really just grounding everyone on the PCAB and what is what is a PCAB? What does it mean to be a board member? What does it mean to be a PCAB member? What does it mean to create safe space? And what is this relationship with the hospital going to look like? And so that did change over time. And as we were kind of transitioning off supporting the PCABs, really talking to the PCAB members, which honestly, over the last several months, they've really been furthering these conversations around, thinking about, so they can make these decisions as a PCAB, and really the community serves as the PCAB chairs around what can the orientation process or what should that orientation process and the sustainability plan look like for this PCAB, and really thinking ahead for some of those factors, even developing materials for some of that. So it is a work in progress. There was some initial time from us spent with the PCAB members and the hospital leaders on that, but really allowing the PCAB members over the last several months to find their own space and path forward and still have us here for support and questions, but they're navigating a lot of those questions to strengthen it.
Yeah, and Adelisa, I want to add on to your points too, and sorry, PCAB members, it's great to see you all in this space, and thank you for the highlights that you all shared today. In terms of orientation, everything that
Oh, I think we lost Christine, but yes, we'll add that we aimed for 10 to 12 individuals on the PCAB, but same thing, the PCAB members are thinking through now around what do those terms look like? How do we bring in new voices, but then how do we still continue to include and integrate and partner with past PCAB members who still want to be active and are passionate about this space? And then looking at, they did have kind of that landscape analysis and kind of a chart so they can think about, who was on the PCAB now, who do we usually engage with? And front of mind is always how do we bring those voices and organizations that we don't usually engage with that are in this space. But I will stop there. Happy to answer any more questions or details around that if you guys want to reach out to us directly, but want to leave space for others to ask members to the PCAB. And I see Erica has her hand raised.
Thank you. Can you all hear me?
Yep, you're good.
Yes.
Sorry, I'm calling in from my phone, so it's a weird process. But I'm curious if you could talk about how you bring your professional experiences or your, the like non-community. I think sometimes we, in the space of when talking about community engagement, we think of communities and then we think of professionals, when really there's a lot of blurring between the two on both the community engagement side and on the health system side. We have health system professionals who have had babies, and we've had people in community who have MBAs and MPHs and professional degrees that can serve in this community engagement role. I'm curious if you can just speak to, how you saw those dynamics playing out.
Do you guys want me to start with that one? So, and I think I forgot who off the top of my head, but this was also a question posed earlier on for the PCAB presentation me and Christine were doing around really acknowledging how can we embrace lived experience of experts to bring those multiple lenses, because there are so many professionals who have that dual, like they have the professional role, but they have this lived experience as a birthing person or a Black birthing person, someone who's a support person. So how do we continue to honor and integrate that experience? And so both. I think it was important to make sure that we had birthing people on the PCABs who or either will give birth or have given birth, at the respective facilities. But then everyone was welcome to contribute their expertise and experiences. And so we did have several PCAB members who also had given birth, whether there or someone else, and were equally invited to contribute their experiences and expertise with their dual hats on. And we often did hear from PCAB members say, like, all right, I'm talking as a birthing person, or I'm talking in this capacity, to really inform the group from which lens they were speaking from. But I don't know, anyone else from the PCAB have additional feedback on that one? Yeah, I think it was a blurring of lines, like you said, because there was sometimes that dual perspective, but in a good way. It really created opportunity for even further experiences and feedback to be shared, and acknowledgement of what each PCAB member contributed.
And actually, one thing I'll add is like the inverse. Professionally, I'm a marketer and writer, and I feel like that also came into play in the work, because I think a lot of these things have to do with how we tell stories, how we talk about things. And so I feel like I brought that expertise to some of the discussions around how can we make a campaign, or like what's the messaging we should be using when talking about something to really reach someone. So I do feel like people brought all of their selves into the work.
And I also
Thank you.
think
I
that
really
it's an
appreciate what,
oh, I'm sorry.
oh, please go ahead, Jen.
I was just going to say, I think it's an incredibly valuable to have people with having dual experiences, the healthcare workers, hospital workers who have also given birth, but can see the other side of it. And then us who have given birth and now have no ties to the hospital, it makes it much easier to share my thoughts, I think, and to, there's really nothing to lose in participating and sharing my honest thoughts in our discussions, and bringing my mental health experience, working in psychiatric hospitals and seeing people at their most vulnerable, and knowing how mental health affects maternal health and child health. But yeah.
Thank you. I so appreciate those points, and I think that's really beautiful to hear that both perspectives were integrated so fully, and that you could talk from, this lens in this setting, but this lens in this conversation. I think that's something that's really unique, to be able to bring those different perspectives and to find people who can bring both lenses on both sides of the PCAB and the community and the hospital setting. Thank you.
There's also one more question in the chat that I'd love to raise to just continue this conversation. The question asks, how did PCABs deal with conflict if and when it arose? So just wanted to bring up that question to this space.
That's a really interesting question. I'll just go ahead and dive in. Would love Jen's thoughts on this too. I don't feel like we had conflict. I think part of that is that there was a trust built into with like the shared vulnerability and everyone sort of trusting the intentions of everyone in the space. It's not to say that we always agreed. Conversations took different turns. Certain things were prioritized and then we might have shifted gears, or there were times where certain topics were, more personal, or people had more experience than other people. So I don't feel like we had conflict. I think there was a big intentionality in the care that we all showed each other in the work. But I would love to hear what Jen thinks.
I agree with you, Karina. I wouldn't say that I could identify any sort of conflict, but absolutely there were different experiences, different perspectives on, various topics. But that mutual respect and that mutual goal helps us focus on we're building collective knowledge so that we can try to make the best decisions to promote change. And so there was a lot of discussion, but there was also a lot of listening, which I think is really the most important part of this, is us listening to each other and taking in what people had to share and their input.
Yeah, I agree with both of you. Conflict was not really anything that we dealt with. We just had that mutual respect. There was a lot of listening, a lot of everyone was just really on the same page, and everyone would just come with their own perspectives and views about something. And somehow we get to the end of what the next action out items would be, and yeah, I mean, it's a for me, it's been a wonderful experience. Our conversations are just so meaningful and so impactful. And I just think everyone was just coming from the same place in terms of what type of outcomes will this have? And at the end of the day, everyone that was at that table bringing their perspectives at the end of the day wanted the same outcome, and we wanted positive outcomes. So, conflict is not necessarily something that we experienced, but it is a lot to process the different experiences and perspectives, right? So, when you're at a table with 10 to 12 different people, all coming from different experiences, it does take a lot to process. So, you really have to be an active listener, and be very open to what you're hearing and to, really be intentional about what it is that we're working on and what really the goal is. And in all of that as we kind of consolidate and really kind of bring everything together to one thing.
If I can actually add one more thing too. I think part of it too was, as you said, about respect, but I think it's also about respect for and trusting other people's like expertise about their own experiences and realizing that, like we're all still individuals, even if we're part of marginalized communities. There might be trends, but we're all still individuals. And my experience as a, queer person is not the same as somebody who's a person of color or somebody like there's so many different experiences and nobody like got to speak on behalf of everyone else. We all brought our unique stories to it. And I think everyone did a really good job of like, holding space, for people's stories.
Peter, do you want to add? I'll play devil's advocate and speak a little bit to the challenges, situations that we saw from an outsider's perspective. But Peter, I saw you come off mute too, so do you want to add?
Yep, thank you. I was just gonna say that I did appreciate the ability to kind of just share insight on or just bring up, hey, because I represent the fathers sometimes, right? And there were opportunities to show that there is programming or resources for fathers, and it just wasn't listed. And I think that was something where we were able to input, hey, let's add this to the material somewhere. So that's where I was able to see some of my background kind of go into the work that's being done.
Yeah, that's all really good feedback. And Christine, I'll invite you to add into what I'm going to say. But I think, challenges did arise and maybe, from the outsider perspective, and oftentimes because we would maybe have PCAB members or the hospital members speaking with us more one-on-one because we were kind of that third party that was helping them navigate through the implementation of this. That we did see a lot of times the PCAB members push back a little bit, right? To really ask questions around why something wasn't possible, what could they do to support that changing, who could they speak to? They really wanted to, escalate it, but in a respectful way. If their answer maybe wasn't what they were expecting or anticipating. We did see that, but as maybe not direct, strong conflict come up, but challenges did arise, barriers did arise, and we did see a lot of times PCABs of both sides really pushing the needle and really seeking to hold others accountable, whether that's through posing questions or asking who do we need to bring into this conversation at this meeting? Should the PCAB chairs or the PCAB leadership have one-on-one meetings with folks? And then on the other side of that too, navigating some of that space, because a lot of those barriers and challenges oftentimes were a little bit of that power sharing. And so there was a lot of opportunities where there was education, support, and guidance for hospital leadership equally to say, why can't we do this approach? Or what resources, information do you need to go have the conversations that you have to have? Because sometimes decisions were outside of their own authority. So trying to be supportive on both ends so that they could, as a group, come to conversation and a decision on what is the best path forward here, and how do we express our feelings around that? Because sometimes there was consensus, and sometimes there was different degrees of feelings around that conversation or decision, and people did just need time and space to speak to them, to digest them, and to come back to them maybe at a future meeting so that everyone could really wrap their head around, the conversation and the strategies or ideas that were shared. But Christine, anything to add?
Yeah, a little bit of what everyone mentioned. I had the opportunity to sit in on all PCAB meetings from Capitol Health side, from the Penn side, with everyone, and I think one of the common through lines that I've saw just for as an observer and someone that helped as a co-facilitator in the beginning stages is really just thinking about that power sharing piece that we just talked about. But if there were ever any type of, conversations that maybe didn't align or there was some misalignment, I think the bigger picture, I think Yolanda and Jennifer just put those points together too. If there was any type of disagreement, thinking about what's the bigger picture that we're trying to accomplish here together as a team and bringing us back to that mission and that vision, which is what I was trying to share upon as technology failed me earlier. But someone mentioned about orientation. And for both of the PCABs, they have bylaws that they created. They have a mission and vision that they created, whether they co-created together these different documents, and not only these documents, but able to go back to them when times did get a little bit difficult or did get a little bit rough, and kind of go back to the impetus of why we even came together. I think that part was important. And then the voting structure too, because if we talk about orientation and, what are the key components or the foundation components of this PCAB, there also has that power sharing or power shift where the PCAB members are the majority vote, right? So just thinking about how that voice spoke really loud, and if there are any ways that we can clear or kind of like level up the conversations, that was an opportunity in between meetings and during to hear everyone's voice. And I think that spoke loud through all the meetings that I attended for both PCABs.
I think that wraps up our questions for the PCAB panel. Adelisa and Christine, I know that there were a few questions from your segment that you didn't get a chance to address. We'd love to just give you a couple of minutes just to answer those questions.
Sure. Thanks, Armini. We'll maybe just take one or two just for time's sake, and we can get you guys out closer to 2 o'clock than after 2 o'clock. But I know there was a question around, especially given substance use and overdose being leading causes of maternal mortality, how are people with SUD or substance use disorder intentionally brought into the process? And so a lot of the conversation we did have with the hospitals was around thinking about patient experiences, both good experiences and bad experiences, or experiences that maybe led to some harm or other experiences to the table. And as we continue to think about the terms of the PCABs and thinking about how do we recruit and engage new PCAB members, thinking about really looking at some of those outcomes and who are they impacting, who's being impacted the most, who could really intentionally be invited into some of these conversations. And so sometimes it was some of the social supports, folks who work with supporting the social determinants of health who were brought into the conversation. But yeah, I agree that really thinking about, what are our outcomes here in New Jersey? What are the outcomes for a specific community or hospital, and making sure we have those different perspectives to the table. And then Christine, happy to let me pose a next question to you. Where did this one go? Somebody was asking about how to talk about or give examples of how storytelling surfaces root causes and how compensation enabled equity as opposed to access.
Yeah. And before I move to that question, I want to kind of close the loop on what you just mentioned too, Adelisa, on the substance use conversation too. So I mentioned that one of the hospitals, they prioritize mental health as being one of their key focus areas that they're going to focus on going forward with their PCAB, just different types of campaigns, even having new structures and personnel in place to be able to fill the gaps around that. And around those care gaps that we talked about in mental health, also had conversations around substance use. So I didn't want that to kind of go out the window. That's super important work that they are continuing to work upon. And we're even seeing that with the second site too, with the really strong conversations in mental health and substance use being really spanned across the conversation. I want to go back to the question that you're asking about storytelling. I could think about that in so many different ways and factors. I think one of the ways that are present right now in my mind we had an icebreaker during one of our first meetings, and I think this is what both of the sites actually emulated in their conversations. They actually just had a moment to share stories, whether it was their personal story, stories that they heard in community, of course, de-identified, if it was their personal story, really being able to attach their name if they felt comfortable. But that's one way I think of rooting and grounding everybody to the conversation and bringing it into reality, because we do hear about the disparities, we do hear about the data, but how can we talk about real stories at the table that are happening in real time? And a lot of the conversations that we've been having today have been around transparency. So that was that data piece. And so for both of the sites that were enrolled in this pilot, they both committed to sharing their HCAHPS data, to sharing their patient experience data transparently with the PCAB members. And I think having conversations that opened up what are people experiencing real time at this hospital facility, and then also looking at teen birth data that also has storytelling components wrapped into it, I think had some layers that were really abound in this work. I want to get to the second part of that question too, Adelisa, with the compensation, but can you please repeat it back? I
Yeah.
think I'm a little fresher.
Yeah, can you talk a little bit or give examples of how compensation enables equity as opposed to enabling access?
Oh yeah. So before we even started this PCAB work, what we did, and at least you mentioned this a little bit at the top of your presentation, is that we looked at best practices all across the nation. We looked at in New Jersey, of course, but we looked all away, across the United States to see with similar programs how they ran it and some of the best practices out there. We took from some of the tools that we're actually going to share following this presentation and this conversation today, and combined it into a list of strategies that the hospitals were essentially required to follow moving into this work. And one of those conversations that we talked about at the table prior was that compensation piece. Looking at the best practices, we looked at how much individuals were getting paid for similar work, consultant work around the area, and really had not only that included, but the social determinant factors that we talked about earlier. So the child care, the transportation, all wrapped into that funding that the PCAB members received. So I think transparency around the funding conversations is important. Talk about sustainability around those conversations too. And we know that everyone should be getting paid for their time, their expertise, for their experiential, thoughts that they're bringing to the table and their intellectual property, right? So that's a really strong component of what the PCAB should always have. And we are actually making, if I could give a little bit of a spoiler, a PCAB toolkit that will be released really soon that has a lot of the compensation models and the different pathways that we followed to even get to those conversations and to be able to have that particular buy-in around those conversations too. So we'd love to share that.
Yeah, and I think that the question you pose both are true, right? Compensation really did improve access by making it possible for people to participate. When we think about childcare and we thought about transportation or lost wages, right? If they were taking time off of work or other opportunities to participate. But then compensation was supporting equity when we really think about like who's participating and how they are valued. So recognizing that lived experience as expertise equal to clinical experience, and really helping those voices that maybe historically were excluded be able to participate. So really, signaling that the meaningfulness and the expertise level that we were valuing within their participation. It was a great question. All right, I see we're at 2 o'clock. Please, if there's any other questions, we definitely want to make sure we get to them. So if you have further questions, you can reach out to Christine or myself directly. You can also pop them in the chat box and we'll follow up with them. But with that, I will hand it back to our colleagues to wrap up.
Yes, thank you so much, Adelisa and Christine, and also all of our PCAB leaders. Thank you so much for just sharing your insights for today's conversation. To wrap us up for today, the presentation, the slides, and then also all of the resources that we mentioned, as well as the recording, will be sent out to all of you in our follow-up email. Our next MAP work session is scheduled for Tuesday, July 14th from 12 to 2 p.m. We're going to drop the registration link for that into our chat box. So we invite you to register early so that you can save the date. And please also feel free to share this registration link with those in your network. And then finally, when you leave this meeting, you're going to be prompted to take a quick survey just to share your feedback about today's session. So please just take a couple of minutes to answer those questions. It's very short, but it's going to help us to improve future MAP work sessions. And if you have any questions, please feel free to reach out to anyone in our teams. But that's pretty much it for today. Thank you so much, everyone, for your engagement. And we look forward to seeing you at our next MAP work session in July 14.